Hi, my name is Dr. Brar and I am president of Nightingale Home Healthcare and affiliated companies. Today what we have here is a device that we want to talk about called the Intel Health Guide. Intel, as we all know, is a reputable company in the field of computers. However, they have invented programs which are installed in this health guide that helps people to have a proactive approach towards their day-to-day health and physical problems. The issue that they brought through this to front of the patient was how they could use and learn about the various disease processes through one of the tabs that is here called Learn More. If you press here, and for health education, you can press based on whatever diagnosis the patient has. They can use it, for example, for congestive heart failure, for COPD, for diabetes, for hypertension. They can press one of these and they can learn more about any of these programs. Now, where Nightingale Home Healthcare comes in is that we notice that this can be a very useful tool for people who are at home, who basically are prescribed various physical therapy exercises by their physician. However, because of the therapist not being there every day, as well as we all are, not being totally compliant, they do not do those exercises as a routine or as prescribed. So we have converted this Intel Health Guide into what I like to call it as your personal trainer. What does that mean? We have basically entered all the exercises prescribed for you as a patient by your physician, specifically meant for you, which is tailor-made for you. And these exercises are eventually progressing with you, and they are changed as you progress. I'm going to give you some examples. Before that, I would like you to know that these exercises has been developed by our board-certified physical therapist, Julia Dixon, who's also our director of physical therapy for the Nightingale Home Health Companies. She, along with the help of the physicians, will then add these onto your program, which will come to you through this device called the Intel Health Guide with the Nightingale Rehab, as we would like to call it, the TeleRehab program. We are going to press a few buttons to take you to show you an example of how this works. So,
home exercise number 10, long arc quads. Sit in a chair with your feet on the ground. Slowly straighten your knee as straight as you are able.
as you see, this is just one example of one exercise. There are hundreds of exercises that Julia is going to basically tape, and then we will send only the ones that are needed specifically for you to recover from whatever, whether you have a total knee replacement, you have a gait abnormality, you have a hip replacement, or a post-cardiac recovery, and post-cabbage recovery, or you basically have arthritis, any kind of ailment that basically requires you to have physical therapy. We definitely, as a home health company, will send you a physical therapist along with an occupational therapist or nurse or whatever else is needed, including speech therapy, social work, or home health aid. But this trainer, this electronic trainer, will keep you on your feet, as they say, on a daily basis, keep you in compliance. This is the prescription to those who feel, what am I going to do today? I have forgotten the exercises that the therapist told me. I don't remember what the doctor wants me to do. So this will start at a set time. It will start warning you half an hour ahead of you, telling that you please get ready for your exercises. Then it will tell you after 15 minutes. Then it will tell you before 5 minutes. And then you start this program so that you are able to then do exactly those exercises that have been prescribed to you by your physician and taped for you by our board-certified physical therapist from Nightingale Home Healthcare. And for example, this first one is done. Then you press, you're done. Then it takes you to the next one.
Bend ankles up and down. Repeat 10 times.
This barcode here tells you on a constant basis how much of the exercise has been done. So if you stop or if you have finished your exercises, at the end of your session, This information is transmitted through your regular phone line onto a clinician at a Nightingale headquarters who can tell you that you did all your exercises, good job, or if you miss any, did you miss it because of you had some pain or you are feeling discomfort, so that we could address it rather than have that ailment go to a point where you land up going back to the doctor's office or you land up going to the hospital. In all, this program that is installed in this is basically to help you get better quicker, and also to keep you in compliance, and also to make sure that you're following what the doctors have told you, because we are all human and we do forget all the things that we hear from our doctors and from our pharmacists and from our nurses. So I encourage you, if you're listening to it as a patient, to please look into this and see how it can help you. And if you are looking at this from a physician's perspective, you can look at it from where your patients will become proactive and basically get better soon. All in all, it's a win-win situation, and we are basically providing the services to all our patients who will need physical therapy but also need a little bit more help in following the regime and the prescription of those exercises that the doctor has told us. So please enjoy the rest of the DVD. There's some TV coverage from TV stations about how they've used the word Star Trek technology. We want to keep it simple. This is your personal trainer, prescribed by a physician for your benefit, for you to get better. So welcome to this new era of healthcare, new era of home healthcare, and the new era of telemedicine and new era of TeleRehab medicine, and started by combining Intel technology along with innovations from Nightingale Home Healthcare. Welcome and thank you.